Type 2 diabetes management and use. Type 2 diabetes is a lifelong chronic disease in which there is a high level of sugar in the blood and is the most common form of diabetes. Insulin is a hormone produced in the pancreas. When someone has type 2 diabetes, fat, liver, and muscle cells do not respond correctly to insulin. This is called insulin resistance. As a result, blood sugar does not get into the cells to be stored for energy.
Our target behavior is managing type 2 diabetes in youth by increasing awareness about physical education and nutrition. It is important that we target this behavior because the prevalence of type 2 diabetes among children and adolescents is increasing at a rate 50% greater than those with type 1 diabetes. Cases of type 2 diabetes account for 40 to 80% of newly diagnosed cases of diabetes in some pediatric centers. Research has shown that diet alone, exercise alone, and a combination of diet and exercise are all equally effective in reducing the progression from impaired glucose tolerance to diabetes. Because of the positive effects of physical education and nutrition, we will be using these behaviors to manage type 2 diabetes.
Our primary audience is going to be males and females ages 13 to 17 years old, and the secondary audience is going to be the parents of those males and females. The demographics we're focusing on are Hispanic and African American males and females ages 13 to 17 years old, as well as those who come from lower income households. We're focusing on these groups because they have the highest prevalence in type 2 diabetes.
Kotler's 4 Ps, which are product, price, place, and promotion, can be linked to type 2 diabetes management and use. In regards to products, we are trying to promote the reduction of type 2 diabetes. Price, on the other hand, is being able to inform adolescents ages 10 to 16 years old about how type 2 diabetes is affecting their health in a negative way, and how to better their health through the consumption of nutritious foods. By using social media such as Snapchat and Facebook, we would be able to use the concept of geotagging locations near parks and gyms, giving our audience multiple places to learn about and manage their health. The use of social media would also be used for promoting deals for both parents and their children to attend exercises classes. We would also advertise these deals at local schools and community centers for those who lack access to social media.
Social cognitive theory is based on 3 components: how people learn from their experiences, the actions of others, and their interaction with the environment. This is a useful framework for designing primary prevention interventions. The behaviors we will be focusing on are limiting TV usage, encouraging daily exercise, increasing fruit and vegetable intake, and increasing water consumption.
Looking at the social cognitive theory a little bit closer, some of the key constructs include self-efficacy, which is the belief that an individual has control and ability to perform the desired behavior. An example would be giving a person the confidence that they can eat healthy and exercise on a regular basis. Behavior capability is understanding and having the skill to perform a behavior. Expectations, which determines the outcomes of the behavior change. Expectancies, which is assigning a value to the outcomes of a behavior change. Self-control, which regulates and monitors an individual's behavior, for example, just being conscious of serving sizes. Observational learning, which is observing and watching the outcomes of others performing the desired behavior. So in our case, this would be having someone watch their friends or classmates who have healthy eating habits and exercise regularly. And lastly, reinforcements, which promotes incentives and rewards that encourage the behavior change.
There are many different messages we want to get out there for our target audience. Through the use of McGuire's 5 A's, we will advise our audience by educating them on facts about type 2 diabetes and the importance of health management. We will advocate by showing them that this disease isn't something that should hold them back from living their life. We will encourage a positive outlook and open-mindedness on their new lifestyle. Lastly, with the use of Kotler's 4 Ps, a lot of our promotion will be done through social media. Adolescents these days are all over social media, so using Facebook, Snapchat, and Instagram would be an effective way of reaching them. An example we have is shown on the right. We have created a Facebook page for our campaign where we will communicate different events we have going on. Thanks for watching.